Okay, welcome guys to our session today. Motivate OTs is hosting uh, one of the experienced OTs that the University of Zimbabwe has ever produced, brilliant OT. As you know, we are running a series focusing on different topics based on what the students and staff at the University of Zimbabwe are requesting us to address. So this is one of the topics that we got. It's forensic OT in mental health. So my name is Tonga Ichichaya. I'm a lecturer in the UK. I'm an OT. I graduated in 2004, and I generally host staff on the Motivate OTs platform. So today I'm joined by Munya Chimara. Munya Chimara has been my classmate, and he's very much experienced in the topic that we're going to be discussing today. So we hope that you guys are going to take one or two things from this discussion on forensic OT in mental health. I wouldn't want to preempt my introductions, but briefly, Mr. Chimara is currently a lecturer in occupational therapy at the University of Namibia. So he is based in Namibia, and he will be talking more about what he has been doing in this setting. Yes. Thank you so much, Munya. We call him Munya, but back then at college we used to call him Solo. so Munya, welcome. Thank you so much for making your time to join us out of your busy schedule, of course. So I would like to introduce yourself and then probably just give us an introduction and overview into the forensic OT mental health settings.
All right. Thank you so much, Dr. Chichaya, for giving me this opportunity to share my knowledge and experience in forensic mental health and perhaps the role of occupational therapy in forensic psychiatry. As Dr. Chichaya has already alluded to you guys, we're in the same class. We were the class of 2000. So
yeah, you can
we are quite old, getting old now. Yeah, we are now into our 40s. Yeah, and I think I spent quite more than half of my career so far in forensic psychiatry or forensic mental health, of which 2 years I spent in Zim, that is Zimbabwe Prison Services. I don't know whether they're still calling it Zimbabwe Prison Services, because the tendency is to call it correctional facilities, as they are doing it here in Namibia. And then I think about 10 years in Namibia, Ministry of Health and Social Services. So forensic services in Namibia actually mainly under the Ministry of Health, whereas in Zimbabwe, they are mainly under correctional facilities. So yeah, as you, from different countries, you realize that these facilities, they perhaps under different institutions.
Yeah.
Okay. And just a bit of an overview, I think, as you probably are aware that when you talk about forensic psychiatry, forensic is something to do with the law, whether it's forensic pathology or forensic whatever. It means the law is involved or the courts are involved. And so when you talk of forensic psychiatry, it's basically the interface between mental health and the law. And it often involves mental health service users whose state of mental state is probably under question. And yeah, from my experience, we mainly have two main categories of mental health service users in forensic psychiatry. That is those who are who we call observation clients. That is clients who are referred to mental health services for observation to determine whether they they are mentally ill or not, and whether when they committed a crime, were they mentally ill or not, and so forth. OTs were also involved in that. I will just highlight our role there. And then we have a second group, which often called, depending from which country you are, they're often called state patients, state president's decision patients, or yeah, they're just called president's patients or state patients.
Sounds
okay, so yeah, so these ones are actually, yeah, after all the court proceedings and assessments and everything, it was determined that they were actually mentally ill when they committed the crime and were not fit to stand trial, and were therefore referred for long-term, let me just say rehabilitation. It doesn't necessarily have to be long-term, but yeah, they are referred for rehabilitation.